hi everyone. Thank you so much for taking part in this roundtable today. I suppose as a really quick intro, I'm Perrin, as you probably already know. I'm the commercial manager at Storm 3. So we're a health tech specialist recruitment agency. And today we just wanted to open up a discussion around scaling a startup health tech business. It will be an open discussion, and we'll hopefully come away with some, great insight from sharing each other's experiences. But first off, it would be really great for each person to just give a really quick intro of who they are and where they're from. I don't know who to go to first. I'll go to Krishna first. You're the first person on my screen.
Oh, thank you. I am the head of engineering for Tomorrow Health. I joined Tomorrow Health 5 months ago after a little more than 7.5 years at Amazon. And I would say I would introduce myself as a builder at heart, where I love building solutions with impact. And I did that with Amazon over 3 different scenarios, where I was at Kintsugi building e-commerce solutions for moms and pet parents, including fulfillment center integrations and e-commerce product search and payments. And then I moved on to Amazon advertising for a couple of years, where we built search advertising technologies, including targeting for advertisers and ad servers that enabled the ads to write and relevant ads to show ads on Amazon search pages. And then I spent 2 years at AWS AI, where we built a new AWS AI service. I led a team to build a service called Amazon Kendra, which is search, but on companies' internal documents to give really good search on those, and I implemented it for Amazon internal websites as well. I wanted to continue building at a startup, and healthcare is a very interesting space, and Tomorrow Health was very interesting for me because of the impact I could have in building technology solutions for home healthcare. We've been building and scaling the team. Tomorrow Health as a team has doubled in the last 5 months. They went from 60 people to 120 people. So in the middle of scaling and moving out into the team. Yeah.
Amazing. Thank you. And then Richard, I'll come to you next.
Yes, my name is Richard Queen. I'm with DignifiHealth. I'm the CEO of DignifiHealth. And I tell people I'm just an odd duck. My degree is in finance and accounting. I've spent a career in healthcare operations, and I've been a tech geek since I could walk. So tell people I speak 1 language and I write about 10. But that's really how I've approached healthcare from an operational role. I've worked many different titles, if you will, both on the hospital and the provider group side, and really always automated whatever I was hired to do, and then shed the suit jacket and go out and work in the clinics or the surgery department or materials management or wherever it may be, really learning healthcare from the ground up and building solutions that technology solutions that provide efficiencies in a Lean Six Sigma type methodology. I do not have a traditional tech CS background, which is allowed me to maybe think a little bit differently as an operator, and then using technology for how we solve those problems. Long story short, a few years ago, I wrote a piece of software while I was the chief financial officer of a large provider group. Wrote a piece of software that had a tremendous impact in the quality of care that we were delivering to patients, the way we could risk stratify our population and capitalize on shared savings contracts with our insurance payers. And so I made the big decision to separate employment as a CFO, dive into the startup realm, and have kind of rebuilt this software to be enterprise scalable and sell into hospitals, provider groups, and building a team. So been through a couple of iterations since then, and still very much have my hands on the product and the build side, engineering as well, but now leading a team and starting to grow and scale.
Amazing. Thank you. And Rima, next. Classic.
Oh, I was on mute. Okay.
Yeah, no, you're on.
Yeah, sorry. So I'm Rima Seiilova-Olson. I'm the co-founder and machine learning scientist at Kintsugi, where we're creating voice biomarker technology that can detect depression and anxiety from short clips of free-form speech. We recently closed the $8 million seed round led by Acru Capital, and we're also recipients of several prestigious National Science Foundation awards for developing novel AI technologies. We are helping health plans and health providers and systems close mental health care gaps. And we are excited to be fundraising for our Series A currently. We are working with Perrin on expanding our team as we expect it will start growing quite rapidly starting next year. As far as my personal background, I'm a competitive programmer. I used to compete in the International Olympics when I was a student. After that, I spent quite a bit of time at a machine learning powered fintech company that was scaling rapidly. Within the 2 years that I was there, we went from 50 to 5,000 branches, and they went IPO last year in London Stock Exchange for $6 billion. It was quite a wild ride. And at Kintsugi, we're experiencing very similar growth, have product market fit and overwhelming demand for our technology. And I'm happy to be here and meet everyone.
Thanks so much, Rima. I didn't know that you were a competitive programmer. That's cool. And Ellen, do you want to go next?
Excellent. Hello, it's great to meet everybody. My name is Ellen Su. I'm the Chief Product Officer here at Wellinks. We're building virtual care solutions for patients with COPD and other chronic respiratory diseases. So we actually started off scrolling backwards, my background is actually started off in fine arts, moved into mechanical engineering, device design, kind of through the industrial design channel, slowly expanded that kind of more broadly into human-centered design. So have done UI UX design and service design. So really taking a broad view of what it means to have a product and what a product is. And so founded my own startup in the O&P space, and that was acquired by Wellinks. And so joined the Wellinks team in January of 2020. And so since then, we've actually been building out our offering. We started off as a device company, and over the past few years have really transitioned through being a connected device company, moving into kind of software, and then really leaning into services over this past year, and being able to expand our offering to better reach patients and better improve access to care, especially to virtual pulmonary rehab services. So I've been building that over the past year, have been kind of working with technology, with design, with service design, and have been in digital health, have a soft spot for devices, even though they are very difficult to work with. And we just closed a $25 million round a couple of weeks ago. So we are doing a lot of team growth, which is going to be leaning on Storm 3 heavily for that.
Congrats.
Amazing. And last but not least, Katy.
Sure. Hi, everyone. Katy Marshall. I'm the Chief Marketing Officer of Calibrate. Calibrate is, we're about 16 months old. The startup focused on serving the 175 million Americans in poor metabolic health with the mission to change the way the world treats weight. So we offer a 1-year program. It combines telemedicine, prescription medication, one-on-one coaching, and intensive lifestyle intervention through content curriculum coaching sessions. And over the past year, we've been able to serve almost 10,000 members, driving at least 15% weight loss on average in those members, and being able to help them sustain it for a year or more. We're now also introducing a 2nd-year program where upwards of 70% of our members are staying on to sustain that weight loss over multiple years, trying to solve the problem of having longitudinal data in this space, which is pretty much non-existent today. So my path to Calibrate was not through the health tech world. It was actually through sort of the consumer internet world. So I spent my entire career in consumer goods companies, consumer internet startups, and I was attracted to Calibrate primarily because it's fundamentally a consumer problem. Like, we all have had struggles with our weight and our health, and this issue is so pervasive that if it doesn't affect you, it affects someone you love. And so was inspired by building a brand with a big mission. I've learned a lot about healthcare along the way. When I joined the team in January, we were 30 people. I had one direct report, and we just raised our Series A. We raised a $100 million Series B in June at our 1-year anniversary, and now the marketing team is 30 people, and obviously continuing to scale quickly across the entire business.
Perfect. Yeah, I know it's a lot of growth. I think we'd spoken about your team going from 1 to 30, like so quickly. And I suppose like on that point, like something that I think is very much in theme with this topic overall, how do you actually grow a team within months from 1 to 30? Like I know you're going through it right now. So yeah, how's it been, Katy?
Well, I'm not going to profess to be the expert, but I'm happy to share what I've learned. So when I joined, we just raised our Series A. I had one social media manager on the team. The whole company was 30 people. And obviously now the marketing team is 30 people. But I knew that we were going to be growing really quickly. And I knew that the ambition was to scale really fast in terms of how many members we were reaching, how we were deploying media dollars, et cetera. So I think depending on the stage of business, it may not make as much sense, but for where we were, I knew I needed to hire my leaders first because I needed to build out a whole team. And there's just a limit to how many roles you can effectively be a hiring manager for while also doing your day job. So I focused on hiring leaders. I started trying to hire ICs and leaders at the same time. And then very quickly, I was like, I got to pivot. And also I figured those leaders would obviously have the most context on who they wanted on their teams as well. So I really focused there with a couple of exceptions in really critical places. I hired my first 3 leaders on board in April, and then very quickly, had a roadmap for them to scale. And I think obviously there's a lot, people typically want to come into a role, settle in, establish themselves. And so just giving them permission that we're going to turn around and start hiring right away. And I'm going to be here and support you through this process. But there isn't time to wait 3 months to build out your team because we needed you yesterday and we need the team in place today. And from a recruiting standpoint, I would say we always lead with our values at Calibrate, values and mission. And I think one of the great parts of being at a healthcare company or health tech company is that you typically have a really inspiring patient-centric mission. And so finding people who align strongly to that, who align strongly to values, has been really critical. And for the most part, we've hired a world-class team. And where we haven't, being able to recognize that and course correct quickly, either by bringing in additional support or making changes fast, has been really pivotal. So that's how we've done it. A lot more to do, and happy to dive into any of that more. But it's definitely been an exciting journey.
I think as well, Krishna, it's probably similar for you. I know you've hired quite a few people in your team recently, and you've, like you said, you've only been there 5-6 months. In a similar boat, and obviously we've spoken about the importance of cultivating an agile and a mission-driven sort of engineering and data team. How do you feel like you're kind of getting it right whilst navigating the all the processes that go with recruitment and doing your day job, like Katy said?
Yeah, I think a couple of things I highly I recognize all of the values and mission. Like Katy pointed out, I think having a noble mission, which is something that we can have in healthcare, it's a big driver. Being very clear about your values and even having those being thought out in the interview process is also important. But I would say one additional point is how we scale. To give you a background, we quadrupled our engineering team in the last 5 months. We started off, with 3, and we have 12 plus an additional 2 more people joining, and we've also added 6 contractors as we continue to scale out, and we plan to double that, right, over the next few months, again to maybe get to 40 by middle of 2022, and to continue to do that, you have to hire. The way I went about doing it was we wanted to hire more senior engineers to begin with. So we set the bar high, And coming from Amazon, I knew what the bar was, and we set the bar high. We interviewed for those caliber candidates, and we did a fair amount of interviews to figure out who are the people who are going to be the right fit. And once we find the fit, we really want to also focus on the closing process. That is one area of learning for me, is that the closing process is really helping them understand the mission in a lot more detail. Where have we been? Where are we going? And explaining that to candidates really helps. They've shown interest just because they've interviewed with us, but now how do we now close it and help them understand this is like two-part. One, how is this great for your career? What are you going to be building? What are the engineering challenges and technology challenges? And the second part is, what are the key business drivers and levers and the mission? How it affects and impacts patients and other stakeholders in the healthcare space, and pushing that forward. That is what has helped me scale to a point where we can now depend on these folks to continue selling those missions for us and helping scale the teams.
Yeah, I think that's really interesting. I don't know if anyone's kind of had similar, I suppose it's probably similar for you as well, Katy, because you two are in I suppose that similar kind of stage, but anyone that's hired with their teams and like the kind of mission focus, have you had similar experiences, anyone? Sorry if everyone's on mute, might have to
Yeah, I don't care to add to that. I give background on myself in my intro. I didn't say much about DignifiHealth, but DignifiHealth, very young. So we just raised a $7 million seed round earlier this year. We currently have 5 on payroll. Currently have 1 more joining, and then we're currently hiring 4 or 5. So growing fairly quickly, but obviously a lot more anticipated growth to come. And that's the challenges that we're facing right now is, how do we define the culture that we want to build in an employee base? How do we protect that culture as we continue to hire? What's it look like? Right now, we can do morning stand-ups with all 5 of us and everybody's on the same page about what we're doing. That's a little more difficult to do when you're, 20, 30, 40 people. And so really just from a logistics standpoint, trying to determine how we set things up to allow different channels of the organization to get carved out, if you will, with that leadership position and teams under them, and how do those teams all stay on the same page, but then all that rolls up through a unified communication channel through executive team and ultimately to the CEO, when right now titles don't matter at all. It's just on paper. How do we really start to define that culture as we grow? So nowhere near 30 yet, but those are the things we're thinking about now to make sure that we don't want to get to 30 and then realize, oh, we should have thought about this before. And so that's the great thing of being able to have conversations like this and work with others who are few steps ahead of where we are and drawing from their knowledge and expertise and mistakes, even to see what did you learn from, and what if you could look back and talk to yourself from a year ago, what would you have said to avoid, and how can that help us do it? So quickly to add on to that, because I still didn't answer what DignifiHealth does, but obviously we're a health tech company, but we're very focused on chronic disease management. So the impact that we can have in increasing the quality of care is by making sure that all of the evidence-based preventative care metrics are completed. So a lot of that is set by the NCQA or by HEDIS metrics with Medicare and Medicaid services, things like that. So we have an engine that takes in all the raw data from electronic medical records directly, matches that up with all the evidence-based metrics and governing bodies, if you will, and have built machine learning algorithms and rules engines that parse all that to spit out what is the needed care. So we call it the right care for the right patient at the right time. And then we make real-time tools available to providers and patients to ensure that care is delivered. So so when we look to scale our staff, it's on the tech engineering front. It's also on obviously compliance and clinical, so that we can continue refining that clinical intelligence engine as well.
Yeah, I think that's really interesting, and something that we we touched on that, didn't we, Rima, before, around like AI within a space that's highly regulated. How have you found that with Kintsugi?
Yeah, it is. I think we're living in very interesting times when FDA itself is trying to understand how to regulate these devices. They want to ensure safety and efficacy of these devices before letting them into the market. But at the same time, since the regulatory framework initially was developed for more traditional devices that don't change as often as software-based devices, or for drugs that also don't change, don't come up with version 1, version 2 as often as software does, the underlying framework is not very well fit and well suited to regulate software devices that are based on machine learning and AI. And it is a very tricky time when we need to, and the FDA itself is in a very unique and difficult position to play that balance while ensuring safety and efficacy, and also not hindering the innovation and letting the devices into the market and patients can benefit from them. So I really appreciate that FDA is conducting workshops and collecting comments from the industry to improve the way they regulate these devices, and they're trying to make it as easy as possible for the manufacturers to get to market faster. Pre-cert program, I think, is like TSA pre-check. I think it's kind of like analogous workflow. So all of these new frameworks are being developed, but they're not quite there yet. It's still very, very challenging for AI and machine learning based devices to get clearance without large prospective studies that usually take up quite a bit of resources in terms of funds and time. So we are still in this situation. I'm very confident that we'll get through this and it will get easier. But at the moment, there are numerous hurdles that we need to go through. So just like Richard was saying, engineering is very important. Research and development is important. But at the same time, clinical and regulatory consultations and just having clinical staff on board on our team is extremely important for us. Not only create a good tool that has a great demand from our customers, but also checks all the boxes for the FDA and other regulatory bodies.
Yeah, just to jump in on there, offering an additional perspective. So in my past O&P experience working in connected devices, we're also working with orthopedic, kind of tangentially related to orthopedic implants, and attended a session at the FDA, and I was actually very impressed with how they were thinking about, how do you not stifle innovation and how do you work with the manufacturers, but thinking about things like, if you have a knee implant that has electronics and software in it and that company goes out of business, what happens to your implant? Does that implant become a cybersecurity risk? Is it still receiving software updates? Is it something that you have to actually go in and revise? What happens if that is a pacemaker? What happens if that's something that's more sensitive? So, questions that are onerous for a company to think about, but incredibly important for a patient as those devices are more and more integrated into the body and as more of them are connected. So thinking about, who is able to access that, what are the protocols, and how do those continue being supported even after the life of the company, considering that those implants are getting better and better and that they're staying in longer and longer. So I was really impressed with how the FDA was thinking about it, and really just the scale of the challenges that they have. They are doing a very difficult and very necessary job.
I think I can add my take on this in terms of implementing technology solutions in the healthcare industry, which also applies to AI. is to my take on this after having spent 5 months in the healthcare industry and coming from AWS AI is that we often hear the word disruption as a way to go about doing this, because there is a lot of technology to be developed in the healthcare space and digitization to do so. To give some context, Tomorrow Health is developing a home healthcare marketplace and works across 4 stakeholders: payers, which are insurance companies, the providers, who are doctors, clinicians who prescribe medical supplies and home healthcare in general, and then we have patients who ultimately receive all of this which is the reason why we're doing all of this. And then we have the suppliers and home healthcare providers on this. So there's 4 spokes, and each of the stakeholders, what I found is that it's really important to listen to them and listen and partner very closely. And so Tomorrow Health actually has account managers, and in tech world, we are agile, but at the same time, agile actually works really well here, because we can take solutions, deploy them, and get quick feedback. And having that connection to say, okay, we deployed a solution, and going in and okay, does this work for you? And even like having a lot of beta testing in that with those partners involved in it has really helped us scale and move quickly. We've developed solutions for all of them at a pace that even like faster than what I would do in companies like AWS, because we've been able to really deliver and have continuous integration and deployment, where we deliver something and then immediately get like things tested in those and get those feedback and continue to iterate. So fast iteration is one way to really scale and really partner and not seek to and listen and understand and change to what they're saying and have those partnerships. Yeah.
I wanted to mention one challenge that we as a very young company faced. We were incorporated November 2019. So we're pretty much a company that was born during COVID, and we're a fully distributed team. Some of our teammates have never seen each other. We got together a couple of times for team offsites, but it's very difficult to hire, especially for cultural fit, when people are not located in the same place where they can interact and they get to know each other in a much more intimate way that is only possible in a face-to-face interaction. So I think it will keep being a challenge for us to hire people who are truly mission aligned, because qualifications are easy to screen for using the resume and having take-home tasks, but having whether it's a cultural fit is going to be one of the biggest challenges, and that will be I think one of the components that we need to take into account when we decide whether we need to have an office and turn into a company that has a physical office instead of a fully distributed team.
We launched in June of 2020 and also have been a COVID baby and fully distributed since we've launched, and now have scaled to over 300 people fully remote. And so like share a lot of the same challenges. And, I think we've gotten folks together, obviously not at a whole company level, but at an individual team level. Both like when I hired my first cohort of 10 folks, I flew them all to New York. We all got in a room, and that was like so important to like kick things off, set the tone. And then we've had smaller teams meet, and actually getting sort of my extended leadership team together now at the end of the year for 2022 planning. But for me, it is like so easy to do, these digital tools are amazing for day-to-day task management, for building really efficient processes, but it is like hard to get real strategic alignment and do like out of the box thinking in a totally remote setting. And also I think especially in like a fast-paced environment when things get tough, having that like, I've met this person, I know we're on the same team, I know we're all fighting for the same thing. It's like so important to like have that, and it's hard to replace. In the interview process, we've like the way that we've gotten around this, because I agree, it's definitely harder, is really just to dig into like probing questions around how around situations and sort of situational awareness, and making sure that like the way that somebody would have handled a situation is aligned to our values and how we think about operating as a business. So there's no replacement for it, but I do think with the right questions, you could uncover info. But we're definitely thinking about like what next year will bring and an office strategy too, just because I think we're all like, you know, we're very good at Zoom, but I think we're all tired of Zoom or Teams or you know, whatever tool you're using.
That's something that obviously has been like for us as a recruitment agency, it's just so like the way things have pivoted in the last couple of years because of COVID and because of remote working is just, it's just a completely different market essentially now. So, and I think it's really, really true what Katy says, like those probing questions and situational questions are the best way, like the best way around it. And also, I suppose on the kind of positive end, it's definitely a challenge, but then it's also a chance for you to get people that you might have just never been able to hire. They might be somebody that's in the middle of nowhere and can't move from that place, and could be like, you know, they might have a family and that would have made it hard for them to relocate, but they're so bought into the mission or whatever it is that you need them to be. So I think that in a positive way, that's something that's actually really good, because I'm sure, Katy, there's people in your team that if you had to be in New York and had to go into the office, you might not have been able to hire them because they couldn't come.
Yeah, and it's been, you know, it's funny because I think different teams have different dynamics, and like the marketing team at the last two firms I've worked at, Calibrate and my last role, the marketing team always is the team who wants to be in person the most, because they want to whiteboard things and they want to brainstorm ideas, and creatives want to be able to share a screen and look at something together and play around and tweak it. But other teams are perfectly happy being totally distributed, and particularly on the technology side, it's a huge advantage to have that flexibility in hiring, right? Like we're all here trying to scale our tech teams, and we know the market's competitive. And so especially when you're looking for really specialized skill sets, being able to find the right person, regardless of where they might be located, as long as they're obviously able to come to work digitally and collaborate, has been really helpful, especially when you need to scale fast.
I think one thing that's been also, you know, I was before we went into lockdown before March, I had always wanted to be able to support a remote team, and for me, it was a big piece of it was for kind of DEI reasons, being able to accommodate folks who have different circumstances. And actually, I've seen it play out. Like we have a number of folks with children, both men and women, who've really been able to spend more time with their families. They work around, you know, picking kids up from the bus stop, picking kids up from school, dropping them off. And so we're really able to work with those schedules and have people in multiple time zones being able to do that and be there, you know, for their kids. It's still rough, right? You know, I think there's so many studies and statistics about how much people have been impacted, especially parents with young children. But even then, I think being able to have that flexibility, you know, if you're able to get them in school, if you're able to get them in childcare, but being able to kind of be there during the important times, you know, take them to lessons, be there with them. I think that's been really important for a lot of folks, and that has opened up hiring opportunities for people who normally would be looking for things that are much closer to home, or, you know, that they don't need to commute to. You know, it's funny, our engineering team is actually the one that is closest to in person. So they're all in Connecticut, which is, you know, an odd place for all of our engineers to be. And then actually most of the other folks are remote. So about a third of our company is remote, fully remote. And I actually went from being in person and being in the office actually for a lot of this past year to moving remote across the country for, you know, my husband getting into residency. And so that flexibility has allowed me to kind of stay engaged with the company and be able to work pretty much seamlessly, which has been great. You know, but it's definitely been challenging. You know, we have some junior employees who are fresh out of college, for example, who need that support and aren't picking up a lot of the kind of just the stuff that comes with working for a company and working in an office in your first job. And so there's a lot of things that you kind of pick up by osmosis when you hear people talking about them that don't happen. And so being intentional about acknowledging that and saying, what are the things that surround office culture and working culture that need to be more explicitly acknowledged.
Yeah, if I were to give my take on being remote, so all of Tomorrow Health's engineers are remote, and it is a tough market for technology in particular. Um, we have been able to hire, around the place. We have people in Maine and Massachusetts and Chicago and Texas and San Francisco. Many people do want to come into the office and meet. Now there are still a couple of people I haven't met, but we have once a quarter. We have a meeting. So I've done this 2 times now, where everybody comes in. We do have an office in New York. Currently just moved into a new large office in Tribeca, and we kind of coordinate so that people can come in at that time, meet not just other engineers, and meet other people in the team, and spend that week, how many hour days? It's either 2 days or 3 days, and really doing things. And we have events. We went out bowling a couple of weeks ago together with the team in South Spear. So we do the things like this, help make sure that you do have some bonding time, which really helps working together when you go off and on your thing. Personally, for me, I felt like I've always been a little remote in this world. So I before Amazon, I was with Siemens. I was in New York, but my entire team was in Austin, Texas. I would do this where I would go once a quarter and do like not really like code anything in that time, and really have an agenda and do like 20 things and meet with all the people and go out with them. That was really helpful for me to connect and set my path for the next 3 months. And Amazon New York, I did have a lot of counterparts in Seattle. In that case, I actually did fly out to Seattle once every 2 months. I actually did go and spend time with people and made sure that the connections are still there. It's totally possible to have this, but to me, I think that to enable you to work closer together and understand each other and know, the little things about each other is important. That makes working relationship a lot more pleasant. So having a little touch point once in a while has really helped.
Yeah. Hopefully that's actually helpful, Rima, because it's something that will be as you grow as well. That's gonna be something that will seem simple, doesn't it? I suppose just like making sure everyone meets up, but that's what drives the culture and keeps people happy as well. Because we're internally, like at Storm 3, we're the same. Like our group that we're part of has grown massively. So in April we were 42 headcount, and now we're 270, and it's global. So these are I was here when there were 40 people. I knew everyone's name. I knew everybody that I saw in the hallway, and now I don't know anyone. So but I think the way that we've tried to overcome that is that we still try and go out together and do things together and fly people over from the other offices as much as possible, and just where we can. Obviously it's tough, especially we've got a Singapore office, and the restrictions with COVID are a bit more strict there at the moment, so it's hard for everyone to travel, but we're still trying to do that as much as possible so we can all just be connected and know each other. So yeah, I think it's the remote work topic has been something that's just been talked about since like for the last couple of years, but it's gonna stay the same, isn't it, until like the world really changes, and then maybe one day everyone will be a remote, who knows. I suppose going back to kind of with scaling and with something that you mentioned, Krishna, about having multiple different like external stakeholders, and literally having customers and patients, and then also having insurers. I think that's something quite interesting, especially maybe from a marketing standpoint, Katy. Like how do you approach that, having such different stakeholders? They all have different motivations?
Yeah, so we're early in this journey. Calibrate launched as a direct-to-consumer platform. We've been direct-to-consumer for the past year, and our direct-to-consumer business is scaling really quickly. But we've, as we've grown over the last year, we've had a lot of discussion about what does it mean to live the mission and to change the way the world treats weight. And a huge piece of that is scaling access. So we know that, many folks will sign up for the program, but obviously it is a $1,600 upfront commitment. You have to have commercial insurance to participate. And so how do we start engaging other stakeholders in the healthcare ecosystem to be able to expand access to folks who maybe wouldn't necessarily get to the program on their own or be able to participate in the program direct to consumer? So we're early in those discussions, but are thinking a lot about, especially with the marketing team, like which parts of the team need to be purpose-built for that each individual channel. So like, what are the capabilities that are unique to DTC? What are the capabilities that are unique to like B2B? Things like field marketing, which is like not a focus for a DTC brand, but would be a big focus for someone who's trying to build relationships with employers, for example. And then there's stuff that will span both. So like there should only really be one brand marketing team because we have one brand to protect. And so we're thinking about that org design today and trying to make sure that we're building for flexibility where there's a lot that we haven't proven yet. And so want to make sure that we have the room to test and iterate and are not overly specializing, but also making sure that folks have clear roles and responsibilities. So creating clear swim lanes and work streams where we need to make sure that we're not asking folks to focus on 10 different things at once. So delicate balance that we're trying to juggle, but see a ton of opportunity in sort of each area of the ecosystem as being an important one. And obviously, like if you want to reach as many people as possible, it's important to be able to diversify. Curious though, how other folks are thinking about it and structuring it.
There's awkward silence. So I know, Krishna, you've already spoken about a bit. Sorry, Eleanor, you off mute there.
Yeah, I mean, and I think this is also just one of the particular challenges and opportunities in healthcare, you know, and I think that's one of the things that anytime I talk to someone who hasn't been in healthcare and who's coming into the space, you know, whether they're coming from a more traditional technology background, either enterprise or D2C, this is one of the things that I tell them. It's, you know, the people who are using your service and the people who need your service, it's different from the people who decide what service they get, or different from the people who are paying for it. And all of those people have different priorities and just different levels of incentive structures. And you know, pointing to examples of, you know, here's how a small change in policy had huge downstream effects on incentive structures, because there are so many layers. And that's, you know, and I don't know that we've figured it out, and we definitely have a lot of work to do there in terms of figuring out the specific interactions, but you know, you can really only take it kind of a step at a time. You work within the particular health system that you have, you build rapport with your stakeholders, you build relationships with the providers, you build relationships with the patients, and then you kind of try to scale that relationship building aspect of it and try to find those champions within each of those organizations that are willing to work with you and kind of organizing around the overall principles of, you know, better patient outcomes, better patient satisfaction. And then it's really, for me, I view it everything from the lens of design and human-centered design, and really figuring out what are the problems and what are their needs, and really kind of within each of those stakeholders, really understanding what their needs are and finding that really thin slice of the Venn diagram where all of the needs coalesce and interact. But you know, it's a hard process, and I think that's something that is just inherent to working in healthcare, and it's a challenge that we all kind of have to lean into.
Yeah, and I think the trends don't constantly changing trends don't help it, right? One single policy can change so many things. FDA had the MCIT, and now it's about to be repealed. Companies who were thinking about getting breakthrough device designation and were very invested in it now pulling back. So I think especially for young companies like ours, the importance of focus couldn't be overemphasized, because yes, we are creating technology that presents value to health plans. It presents value to health providers in the fee-for-service model, to health providers in a value-based model. It does present value to self-insured employers, but where is our value the most accretive, and where we bring the we make the biggest difference. And starting with that market, landing there, expanding, learning about that opportunity, learning about that market and owning it before we switch to the other types of stakeholders is really challenging, because demand is overwhelming and we need to be able to ruthlessly prioritize, because as a startup we have very limited resources and every hour we're spending on one account is hour we're not spending on the other one. And it is a very challenging task, especially in the early days of the company. So as we grow and scale, we, as Katy was saying, we do want to diversify, because we also don't want to be dependent on one market, and with a single change in policy, all of our value proposition is questioned, right? So, but it's at the same time we need to pace it so our team can handle that volume of demand. And it's a very tricky situation and trade-offs at the very early stages of our company.
Yeah, I'm not sure if anyone else has kind of like comments on it. I know, Krishna, you'd spoken about this kind of area before, and we've only got 10 minutes left. I don't know where the time's gone as well. I just realised. Was there anything else that anyone kind of wanted to add or raise, like any questions or challenges that they're facing?
I've already spoken about it. I would say again that as you listen, you also want to measure the trust factor with your stakeholders. That's one thing where and kind of adjust even your solutions and even your strategy if it's not developing the trust. That's actually a critical element, and get feedback and feed that back into your product process. And that's part of being agile and part of using technology to solve the problems. And measuring things like CSAT, customer satisfaction scores, even on not your patients, but even maybe somebody like the home care providers, and how are they, and getting that feedback is also critical. And if that's kind of dipping or moving, then you want to take a hard look at, okay, did we do the right thing, and what can we do to continue aligning all of this? I think it's a ongoing process to keep things aligned, and you have multiple stakeholders. You might think you have it, but if it gets misaligned, you have to keep adjusting the alignment so that what are the little changes you can make.
Yeah, that's really.
Oh
no, go Ellen.
Yeah, I think there's also internal stakeholders as well. So, with our product team, we're working closely with our commercial team, and we have been building capacity and switching from, when we were a device company, we were focusing on the direct to consumer market, and now we've been kind of pivoting into trying to get good at B2B sales and working with payers and IDNs and all of that. And I think the time scale for what they need and when we can deliver it, we work on a very agile process where we're constantly iterating and improving, which means that I can let what we're working on in the next 3 months or so. But if you tell me, if you ask me to nail down exactly what the product looks like in a year, I'm probably going to get it wrong. And it's probably not going to be, the vision that I set is not going to be as good as what we'll actually end up with. But the commercial team, they're working on these sales timelines of, 8 to 12 months kind of sales timelines. And they, in their first call, they need to be able to show the customer what they'll be working with at the end of that 12-month process. And so, that's been a point of us trying to figure out, how can we deliver them what they need while still staying true to our process. And that's just, figuring out, kind of being intentional where there's flexibility, what we know to be true, what are kind of the big broad strokes that we can commit to, and then allowing us to focus on improvement and optimization and evolution within the details of it. So being able to get them kind of the level of specificity that they need without overly committing to, a product that is constantly improving and evolving.
Yeah, perfect. I think it's something that we kind of had all spoken about beforehand briefly, but I think it will be interesting to see how things pan out as well for those of you that are kind of moving from maybe direct to consumer to B2B. I hear that a lot with clients as well that are about to go through that, and obviously commercial, the sales teams have like a huge part to play. So yeah, just I suppose we're kind of going into the last 10 minutes. So the only thing that I really wanted to kind of ask as a final question really to everyone was, what would be your best piece of advice to anyone scaling a health tech? And I know it's quite a broad question, but if you have like 1 or 2 sentences, what would your personal advice be? I don't know who to go to first. Whoever wants to go first can just jump in.
I'm happy to kick it off. I think mine is like, you heard us all talk about the importance of mission and values, and like building that mission and values into your strategy early, embedding them. At Calibrate, we actually have the same external and internally facing mission and values. So the values that we live by internally are the same that we promise our members. And we find ways to embed them in every company routine. We give awards based on our values. We structure every I think especially in a distributed world, building that consistent muscle around values and mission is really important, because you're not all huddling around a water cooler together. Like, the values are really the glue that holds the team together.
Yeah, I think that's a really good one. Anyone else?
I'll play off that some. I think, with mission and values, I think that's all why we're attracted to startups, right? We love the build, we love that side of it, but we also love the mission and values that are, harder and harder to keep the bigger and bigger you get, coming from large corporate world. So one of the things that I think is very important that we have a responsibility to society, if you will, in what we're building, is building it in a sustainable manner, which means building it in a way that creates profitability and sustainability, so that we're not having to, only rely on raising Series B, Series D, Series E, Series F, and we can't raise anymore, we're out of business. We see that among so many IPOs now that are going public at just crazy multiples, but then they lose 75% of their stock value a year later because it's unsustainable. And so I think part of the mission is not just going for a big paycheck at IPO, but building a sustainable company that benefits the next generation as well. And can you make a buck while you're doing that? Absolutely. But it comes in the long run, not in, a 24-month IPO that is worth nothing in 4 years.
Yeah, I think that's really important. That's like a kind of, we see that so often in kind of, I suppose, the tech world across the board, that it's like a bubble, isn't it? And at the moment there's been such a push since COVID, like suddenly everyone is giving funding and everything. But you're right, it's important, like when the mission is important, it's important that is sustainable as well. Yeah, that's a good one. We've only got 5 minutes left, but I suppose I'll come to Rima. What would your key piece of advice be for scaling a health tech?
Yeah, as a person who does not have background in healthcare, myself and my co-founder CEO, both of us were very surprised by how long the sales cycles are. How many regulatory layers do we need to go through before signing a single contract? So anyone who is trying to enter the health tech field, having a lot of patience, and at the end of the day, believing that every single stakeholder in this whole process does want to improve patient care, and remembering that even if there are challenges of regulatory or compliance, security related, at the end of the day, everyone is trying to make the system work better for the end patient. So even if there are hurdles, there is a reason why they were put in place. So having an open mind and understanding that every single stakeholder is acting in the best interest of the patient, and if we want to make that positive impact and impact the clinical outcomes in a good way for patients in the long run, having some patience at the beginning and sticking to the paths that are established and the standard for healthcare as a field where one single contract takes 12 to 18 months to sign is okay, because in the long run, we're all rowing towards the same direction and we're all trying to improve care, and we'll get there as long as we have patience, because anyone who's coming from consumer or pure technology background finds it extremely frustrating. And the trick is to actually understand that we're going to that goal all together with the various stakeholders, but it just takes a little bit more time than in other industries.
Nice. And yeah, I suppose Ellen and Krishna lastly.
Yeah, I think tying those two things together, I think the values are incredibly important. And one of the things about healthcare is that it attracts good people and attracts people who want to make a difference. And so it's actually, I would say, there is a push for it. If you talk to folks in technology companies and you talk to folks who are kind of in consumer businesses, there are a lot of folks that want to get into healthcare because they want to make a difference. They're looking at what they're doing on a day-to-day basis, and they're looking at what the kind of the mission and the values are within healthcare. And I think you're able to find great people who really have that commitment. And so then it's basically giving them the crash course into how things work in this environment, which is a little bit different. But it's taking that energy and being able to harness that, and then being able to tie that into kind of those core values of the company, because there are so many things to do, and there are so many we have a lot of regulations, and those are to prevent folks from taking shortcuts, and like you said, they are written in examples of ways that things have gone wrong, and we are working with people's lives, and in an industry that is not optimal, I would say, at least in the US healthcare industry, but it almost everybody that you meet is trying to make a difference, whether that's employees, whether that's your teammates, whether that's your customers and your partners, and as well as other startups in the space. I have learned so much from other companies that have been going through similar challenges, different size companies, different stages of companies. And so the community aspect of that has been really strong. And I think all of us are working against the same challenges, and we're all kind of tackling it from different angles. And so I think, any innovation that we're able to put forward with any of our companies helps the entire ecosystem. So it's been really great to be in that supportive environment, and seeing so many other companies that are tackling, we see 100 different issues in the market, and knowing that there are great folks that are tackling them is a really great part of being in healthcare.
Yeah, it's a nice and positive outlook on all these. I really like it. Krishna, last but not least.
Yeah, I think I think a lot of great things have been said. I agree with all the things. I believe the values and culture are foundational for how you scale. To double click on culture, especially on the tech side, I would say one of the advice I'll give is to build a great tech team. Make sure the why is very clear, and that goes all the way down to every single story you're building. To make sure that the engineers in the team and data scientists, everybody has the idea that if you're not clear on why you're building something, you shouldn't be building it, and stop and ask and make sure that everything is there. Getting that really built into the culture to say this is what you should do as you onboard more and more people. It's very important, so that empowers them, and creating the culture of even challenges in a respectful way to say, okay, why am I building this? Is there a better way? And empowering the tech team to actually do so can, I think, make a big difference, because the technology folks have a lot of ideas, but more often than not, several technology members are more introverted, and they do sometimes put their head down. But it's important that we constantly seek their feedback and advice, and build a culture all the way throughout, to make sure that they have the voice and they are empowered. This would be my advice, to continue building that culture out.